So now if we look at all has been done, so the whole United States and North Carolina and the medical profession for that matter has chased the shiny nickel on COVID-19. I think it's very important to understand that while we've chased the shiny nickel, we've hurt this other part of our population. And I'm going to give a few examples for that. We have caused collateral deaths because of our interventions, because of this. Let's talk about that. A good article in Chest, which is a thoracic surgery journal, documented an approximation that 80,000 cancers for the first 2 months of this epidemic were not diagnosed. So what we're going to see in about 3 to 4 months is a marked spike in the number of metastatic cancers, which are more lethal and cost much more in the United States. Again, collateral damage because we were chasing COVID. You saw the same thing with people with heart attacks. People at home had chest pain that didn't go out because 1, they were afraid to go out, 2, the emergency rooms told them not to go out, and 3, their doctor's offices were closed. So we're going to see a much greater spike in that, and I think there's some data from Chicago about a month ago that shows that 3 times as many people died at home during 1 week from cardiac-related illnesses and neurovascular-related illnesses than before. So there are some things that we need to think about so we don't just get so myopic that we're thinking just about death from COVID-19. The collapse of businesses. These are folks' life savings. There have been many documented suicides. Tennessee has some good examples of that, where the suicide rate has really gone up about 30 or 40% because of despair, because of not necessarily COVID, but reactions to COVID. And finally, mental health. Mental health, I've talked with a lot of sheriffs in our district and across the state. I talked with one in Arizona yesterday, actually. The number of cases of domestic violence are up anywhere from 30 to 70% higher. People stuck at home for different reasons, and it's caused a spike of this. Education has also suffered. Kids don't learn as well looking at their teacher on Zoom, and this is going to be a challenge for us in the fall. So should we be in a point of panic? No. Our cases are going up in North Carolina. Those are facts. Those are facts. What should we be doing moving forward? I think we need, first and foremost, to keep our nursing homes sheltered and in place. That is obviously our par one, our most important area. So that's, again, an opportunity which we have not done a very good job in the past that we can do now moving forward. So what do you do with all the other folks? If you're asymptomatic, if you're under age 65, if you don't have significant comorbid diseases, why are we penalizing in North Carolina the infinite number of individuals who do not fit in high-risk categories and push them into poverty? I think that's a discrepancy in our policy. I think that's something that we should not be doing. All the states that border our state, Georgia, North Carolina, Tennessee, they've changed those rules. And our lines and their lines are no different. So it makes me question why. We go back to why Republican governors are doing one thing, why Democratic governors are doing another thing. And, is it politics? Is that what the motive is? I don't know, but there's definitely a difference, and why that is, I just don't know. Unfortunately, the state just lost probably over $150 million because we had a convention that was going to be able to come here to Charlotte. Badly needed dollars. And it's unfortunate that there could not have been something that folks sat at the table showing how important that was to the state and worked out a compromise. Those are terribly needed dollars for North Carolina, and it's a tragedy to this state that something was not worked out. So let me end with this, guys. Unemployment leads to poverty. Poverty leads to despair and health inequities. And health inequities and despair lead to death. So why, in the face of clear data from this state and every state around us, do we persist in keeping people unemployed? We're keeping people unemployed. What happens when they're unemployed? They lose their health insurance, and they don't get the relief. And I know the governor wants Medicaid expansion in the state. He's made that very, very clear. But I don't think keeping people unemployed and impoverished is the way to do it. So I'm going to submit to you that moving forward, we have 4 C's. Number 1, a coherent plan for testing. Number 2, communication and transparency. There needs to be consistency amongst regulation, not changing the goalposts. And then collaboration, guys. We need interagency collaboration. We have healthcare institutions in this state, healthcare systems that have offered to help. They're the ones that have taken care of the patients in this state. They need to be utilized. They have the processes in place. They're the ones that can have swarm teams that go out to nursing homes, and they can do this. I think we've done good things. I think we've missed opportunities, but we're in a rare spot now where things are going up, where we can learn what we've used from the past and make things better for the state moving forward.